What about patients who lost their consciousness? In thinking about the questions discussed in the last section, it is important to remember we are here to talk about subjective experiences. That is, what is the difference between conscious and unconscious representations in the brain? But there is another usage of the word consciousness that is also very meaningful, but only in a different context. That is, when we say someone passes out and loses consciousness. We can call this notion of consciousness wakefulness, or more precisely, state of consciousness. It is certainly an important notion, especially in a neurological context. Patients with traumatic brain injury, TBI, may fall into a coma and lose consciousness in this sense. There is some beautiful work done in this area by cognitive neuroscientists too. For example, sometimes when a patient is not responding, it would be useful to know whether they are completely unconscious, or maybe they are conscious to some degree, but only failing to respond. There are cases, for example, where the brainstem is damaged, so that the patient may actually be conscious, but their motor outputs are blocked. We say these patients are in a locked-in state. Obviously, if they are still conscious and feeling pain, we should treat them very differently than if they are in a fully vegetative state. Or the patients may be minimally conscious. That is, they may be in some gray zone between being fully conscious and fully unconscious. There is clearly a clinical necessity to find out which state they are in exactly. Adrian Owen has done some truly remarkable and ingenious work in this area. He capitalized on the fact that when people are imagining doing different things, different areas of the brain will be activated. These can be observed in fMRI. So, for instance, if we ask people to imagine playing tennis versus to imagine navigating through the different rooms in one's home, the patterns of brain activations may look different. You may recall that the supplementary motor area, SMA, is important for endogenously generated actions. Turns out, when you just imagine acting, you activate this area too. So imagining playing tennis would activate this area as observable in fMRI, like in the panel on the left shown here. Imagining navigating through one's home would involve a different set of regions, as shown in the figure on the right. PPC is the posterior parietal cortex. PMC is the lateral premotor area, also important for action, especially of the reactive kind, driven by visual information. PPA is an area around the hippocampus, called the parahippocampal place area. You may recall that the hippocampus is important for memory. The PPA is particularly important for memories for places and scenes. The details may not be so crucial. What is important is that these two images look different, so that if we ask patients to imagine one thing over another, and indeed we see the corresponding images in the brain, they are probably responding meaningfully. So they must be conscious, in a sense. Now then, while studies like this one are extremely important, unfortunately, this is not going to help us very much in answering the 4 questions outlined in the last section. Why? Let's say using the above method, we find that a certain patient is unconscious in the sense that they cannot respond to requests to imagine playing tennis versus navigation. The fMRI images just look the same regardless of what we ask the patient to do. One may think we can compare the brain activity of a healthy, conscious subject versus this unconscious patient, and this way we can find the neural correlates of consciousness, NCC. But the problem is that patients are not only unconscious in the sense of lacking subjective experience. Probably also missing will be their ability to respond to things, to reason, to remember, or to process information in general. That is to say, the comparison between a normal conscious subject versus an unconscious patient in a coma would not be so clean. It would include too many experimental confounds. This concept of confounds is very important, but often difficult to master. Let's talk about this a bit more.